Assalamu alaikum. Welcome to the all student. Here is the Dr. Fiaz Karim. The second part of our video is for the preparation of medical officer exam for Punjab PPSC MCQs based exam preparation for the student after MBBS. So best of luck. We start from here. Bismillahirrahmanirrahim. The drug of choice in the paracetamol poisoning is the penicillamine and the amyl nitrate and acetylcysteine and the cholestyramine. The correct option in this case is the N-acetylcysteine. In the next question, which of the following prevent the cardiopulmonary complication in the scorpion bites? Option number A is the injection antivenom. The second option is the local infiltration of the lignocaine. The C option is the corticosteroid. The delta option is the pyrazosine. The correct one is the pyrazosine. The next question 43. The accidental hypothermia has been found in all of the following except the option A is the Cushing syndrome. Option B is the mixed edema. Option C is the pituitary insufficiency, and the delta option is the acute myocardial infarction. The correct one is the option A is the Cushing syndrome. The question number 44, endemic fluorosis is featured by all of the following except option is exotosis, option B is the kyphosis, option C is the chalky opacities on the teeth, option D is the osteoporosis. The correct option is the D, osteoporosis. Question number 45, pink disease in heavy metal poisoning. Number A option is the mercury, number B option is the copper, option C is the arsenic, option C is the delta is the lead. The correct one is the mercury. Question number 46, the cigarette smoking is not a risk factor for the development of option number A the thromboangiitis obliterans, option B is the systemic hypertension, option C is the ischemic heart disease, option D is the atherosclerosis. The correct option is the systemic hypertension. The question number 47, which of the following poisonings is not treated by the penicillamine? Option A is the copper, option B is the antimony, option C is the lead, option D is the mercury. The correct one is the antimony. Intermediate syndrome is seen in the poisoning with option A is the organophosphorus poisoning, option B is the benzodiazepine, option C is the mushrooms, option D is the cadmium. The correct one option is the organophosphorus compound. The question number 49, raindrop pigmentation is a classical in the poisoning with option A is the antimony, option B is the cadmium, option C is the arsenic, option D is the copper. The correct option is the arsenic. The question number 15, basophilic stippling in the RBC is found in the poisoning with the option number A is the mercury, option B is the lead, option C is the gold, option D is the cadmium. The correct option is the lead. Question number 51, victims of the mushrooms poisoning and Tennessee felidios may die of option A is the acute tubular necrosis, option B is the cardiac stenosis, option C is the raised intracranial tension, option D is the acute hepatic necrosis. The correct one is the acute hepatic necrosis. Question number 52, in the mercury poisoning, death is usually due to option C the hepatocellular failure, option B is the hypovolemic shock, option C is the renal failure, option D is the encephalopathy. The correct option is the renal failure. Question number 53, hyperkeratosis of the palm and the sole are seen in of the following except option is the tylosis, option B is the arsenic poisoning, option C is the ferinoderma, option D is the Beckett's syndrome. The correct is the delta option, Beckett's syndrome. Question number 59, the Prozin's reaction is related to option A is the near drowning, option B is the necrotizing vasculitis, option C is the anaphylaxis, option D is the atopy. The correct option is C, anaphylaxis. The question number 60, amyl nitrate inhalation is useful in poisoning with option A is the hydrocyanuric acid, option B is the organophosphorus compound, option C is the monoamine oxidase inhibitor, option D is the methyl alcohol. Correct option is the hydrocyanuric acid, A. Question number 61, a bitter almond odor in the breath may be detected in poisoning with option C is the cadmium, option B is the mercury, option C hydrocyanic acid. Option D is the carbon monoxide. The correct one option is the hydrocyanic acid. Question number 62. The cryptococcus neoformatus is option A is the fungus. Option B is the produces the hepatosplenomegaly. Option C, a higher bacteria. Option D is treated by the IV leviidine. The correct one is it is a fungus. Question number 64. All are established causes of the SIADH except number 1. Option number A is the meningitis. Option B is the hyperthyroidism. Option C is the odd cell carcinoma of the lungs. Option D is the acute intermittent porphyria. The correct option is the B option, hyperthyroidism. Question number 65. Casmol's respiration is characteristics of the option is the metabolic alkalosis. Option B is the respiratory acidosis. Option C is the metabolic acidosis. Option D is the respiratory alkalosis. The correct one option is the metabolic acidosis. Question number 66. Cause of the hyponatremia with the normal extracellular fluid are all of the following except number. Option A is the nephrotic syndrome. Option B is the diabetic ketoacidosis. Option C is the hypothyroidism. Option C is the option delta is the use of the diuretics, and the correct option is the diabetic ketoacidosis. Volume depletion combined with the sodium and the water depletion does not occur in the case of option A is the cirrhosis of the liver. Option B is the peritonitis. Option C is the chronic renal failure. Option D is the adrenal insufficiency. The correct option is the cirrhosis of the liver. Question number 68. Skin turgor is the best examined. Option A over the abdominal part is. Option B is the over the dorsum of the hand. Option C is the over the sternum. Option D is over the cheeks. The correct one is the over the sternum. The question number 69. Which of the following is the feature of the respiratory alkalosis? Option B is the asterixis. Option B is the papilledema. Option C is the water hammer pulse. Option D is the tetany. The correct option is the tetany. Question number 70. The clinical hallmark of the homocystinuria is. Option A is the osteoporosis. Option B is the mental retardation. Option C the dislocation of the lens. Option D is the option B is the thrombotic vascular disease. The correct option is the dislocation of the lens. The question number 71. The Rudras test is the positive with all of the following ingredient except option A is the beta hydroxybutyric acid. Option B is the acetone. Option C is the drug treatment with the salicylates. Option D is the acetic acid. The correct option is the beta hydroxybutyric acid. Question number 72. Sweaty feet odor is found in option A arginemia. Option B is the glutaric aciduria. Option B is the hypervalinemia. Option C is the isovaleric acidemia. The correct option is the isovaleric acidemia. Question number 73. Question number 73. The starvation is thought to be the life-threatening condition when the body weight falls below the level of option number A is the 40% of the normal. Option B is the 7. Option D is the 70% of the normal. The correct option is the 70%. Option D. Question number 77. Exacerbation of the SLE systemic lupus erythematosus is produced by option A is the rifampicin. Option B is the oral contraceptives. Option C is the carbamazepine. Option D is the risperidone. The correct option is the oral contraceptive. The question number 78. Which is not a feature of the autonomic neuropathy in the diabetes? Option A is the retrograde ejaculation. Is the B is the gestatory sweating. Option B is the mononeuritis multiplex. The the delta option is the hypoglycemia unresponsiveness. The correct option is the mononeuritis multiplex. Question number 79. Beta blockers can be used in all of the following. Option A is the glaucoma. B is the bronchial asthma. C is the anxiety state. Is the option D is the angina pectoris. The correct option is the bronchial asthma. Question number 80. In the pleural effusion, minimal amount of the collection of the X-ray detection is. Option A is the 50 ml. Option B is the 80 ml. Option C is the 150 ml. Option delta is the 300 ml. The correct option is the 300 ml. up till now we have discussed the academic portion of this part of exam, and now there is a general ability MCQs, the general knowledge question. The question number 1, the 81, Kurlai Island are situated between the USA and the Canada. Option A, the B option is the Russia and the Japan, the C the India and the Russia, the D is the China and the India. So the Kurlai Island are situated between the Russia and the Japan. The correct option is B. The question number 8. Question number 82. The Durand Agreement was concluded between the British India and the Afghan Amir. The question A is the Khan Abdul Jabbar Khan. Option B is the Abdul Khalik. Option C is the Sharif Khan. Option D is the Abdul Rahman Khan. The correct one is Delta option is the Abdul Rahman Khan. The question number 83 is the UNO day is observed on. Option A is the 5th October, option B is the 24th October, option C is the 21th October, option D is the 15th October. The correct one is the 24th October. Question number 84, who compiled the first English dictionary? Option A is the George Pearson. Option B is the Samuel Johnson's. The correct option is the Samuel Johnson was the person who compiled the first English dictionary.